How do you know if you accidentally put an IV in an artery instead of a vein? Let's talk about it in this week's tip of the week. Rest assured that this happens. It is rare, but it does happen, and there are a couple things that we can do to prevent it from happening. So whenever you're putting an IV in, it's important to palpate the vein and make sure that you don't feel any pulsating. If you're going into a deeper vein or a vein that is known to be next to an artery, it is good to be extra careful and potentially use an ultrasound if you're certified to use an ultrasound. But just in the off chance that you accidentally hit an artery instead of a vein, here are some things to look out for. The color of arterial blood tends to be much brighter red than venous blood. So when you get that nice blood return and you're flushing your IV, go ahead and pull back, aspirate a little bit to see what color blood is returned. Arterial blood also has a much higher pressure, higher flow. And so if your blood return is spurting out, squirting out, it may be arterial. Another thing you can look for is pulsating in the IV catheter or J-loop. I'm sure you have seen where you flush an IV and you clamp it, but then you still get that little tiny bit of blood return in the IV. Well, if it's in an artery, there's going to be that increased pressure, and you may actually see some pulsating right there in the IV catheter. I even had a friend tell me that they saw a bubble that was in the IV tubing, and that bubble was what was pulsating and led them to believe that this was in an artery. If you do accidentally place an IV in an artery, take a deep breath. We're going to go ahead and pull it out, but it is an arterial line, so you're going to need to hold pressure for a bit longer than you would than for an IV. Typically 2 to 3-ish minutes, sometimes a little longer, but typically that's enough. Just make sure you get complete, stop of any blood coming back out, apply an occlusive dressing, and go ahead and try again.